pretty upset, understandably so, when I told you that 20% of people who give birth will have their pelvic floor muscle tear off of their bone, at least partially, and that we don't generally check for that postpartum. And when I say we, I mean the healthcare field as a whole, partially because it takes some special imaging to do so, and partially because we don't currently have good surgical options for it, and partially because some providers just don't know about it. As a pelvic PT, I don't really have any control over whether or not people get imaged like right after giving birth to check for this, but there is something that I can check when they come to see me as a pelvic physical therapist to see if this may or may not be something that is contributing to their issues. Number one is just palpation. I can sort of feel, when I go internally, I can feel whether or not there is a muscle attachment to this bone here. And we know that from the research, palpation has pretty good sensitivity and specificity, but it's not as good as imaging. So we can somewhat feel whether or not this muscle is attached to the bone. I can definitely feel when somebody has one side that is very much not attached and the other side that very much is. That can be a little bit easier to tell, but it's a little harder when maybe there's a partial tear or both sides are torn. It gets a little bit trickier. So another thing that we can check is called the genital hiatus measurement. We take a little ruler and we measure the distance between the bottom of the vagina and the urethra when somebody is bearing down, because somebody who has had a levator ani tear generally is going to have a much larger space. We call this ballooning, which is kind of a terrible term, but they're going to have a much larger space from here to here as they bear down, and that can tell us, has there potentially been a tear of this muscle? When we combine this measurement with the perineal body, which is from the bottom of the vagina to the anus, again on strain, that can give us some information about how likely someone is to have a prolapse or to develop prolapse. This measurement is also pretty strongly correlated with the general size of the levator hiatus, which is what they're going to be checking on ultrasound. So what I'm ideally looking for is a measurement less than 7 centimeters when they're bearing down. This is telling us that there's generally a very low risk that there was a levator hiatus tear and a low risk for prolapse. But once we get over about 7 centimeters, that risk starts to go up. When I said there's nothing we can do about it, this isn't entirely true. We don't currently have a well-validated and well-studied way to fix that avulsion or the muscle tearing off of the bone, but we do know that these women can absolutely benefit from rehab, from pelvic floor muscle training, from potentially fitting a pessary, from exercise management and modification. All of the things that pelvic PTs can do can absolutely help people with their symptoms and to help manage any prolapse symptoms that may come up down the road.